In September 2008, GE, a 78-year-old male surgical oncologist who was otherwise in good health, had a stroke. The MRI-MRA revealed an acute infarct involving the right lentriform nucleus, moderately extensive chronic small vessel ischemic changes, chronic lacunar infarct involving the right ventromedial thalamus, and intracranial atherosclerotic vascular disease. The stroke left GE with aphasia and a reduced ability to perform any physical activity. October 2009, 13 months after the stroke, GE began taking SE. GE consumed 1 gram twice per day, and after 8 weeks, GE noticed improvement with his speech and experienced more energy with improved balance. In April 2010, a repeat MRI-MRA showed no evidence of an acute infarct. GE's aphasia was completely resolved at this point, and his overall mobility was improved, allowing him to perform all activities of daily living. In January of 2011, a repeat MRI-MRA of the anterior and posterior cerebral arteries demonstrated no evidence of hemodynamically significant stenosis and revealed normal vertebrobasilar arteries with no evidence of intracranial aneurysm or vascular malformation. To date, GE has resumed playing tennis at age 81, walks around the mall in the neighborhood with other senior citizens, and has returned to his professional activity as a surgeon. This case study was taken from a chapter in the book, Tissue Regeneration: From Basic Biology to Clinical Application. The link to the chapter is in the description below.